According to the United Nations, the COVID-19 pandemic represents the largest global public health crisis in a century. It is not over yet, with current average of approximately 1 death for every 32 minutes. COVID-19 continues to disrupt healthcare systems across the United States. My name is Mohammed Yousufuddin. I'm an assistant professor of medicine at the Mayo Clinic and the lead author.
My name is Jewell Doss. I'm a registered nurse at the Mayo Clinic Health System and a co-author.
On behalf of all the authors, we would like to summarize the key findings of an article, characteristics, treatment patterns, and clinical outcome after heart failure hospitalizations in COVID-19 pandemic, March through October 2020, which is featured in the January 2023 edition of the Mayo Clinic Proceedings. This original research article is produced in collaboration with the Mayo Clinic, Aurora Health System, Wisconsin, and the University of California, Los Angeles. On March 11, 2020, COVID-19 was declared as a pandemic by the World Health Organization. Soon after, it was proclaimed as a national emergency in the United States. These assertions had profound repercussions across the healthcare systems. Emergency department visits for acute, life-threatening medical and surgical emergencies have dropped precipitously. All elective surgical procedures have been cancelled. COVID-19 had a knock-on effect on the diagnosis and management of every other non-COVID-19 related illness. In this context, we set out to explore the impact of COVID-19 on heart failure. To accomplish this goal, we enrolled 6,769 patients with close to 9,000 heart failure hospitalizations at 16 Mayo Clinic hospitals across 4 US states from October 2018 through October 2020. We conducted a systematic search of electronic databases to synthesize narrative review to place the results of the present study in the context of published literature. Heart failure patients hospitalized in the first 8 months of COVID-19 pandemic, that is from March through October 2020, when compared with those hospitalized in the pre-COVID-19 time frame, spanning from October 2018 through February 2020, demonstrated the following key features. Number one, a decline in monthly rates of hospitalizations. Number two, similar incident in hospital complications with equitable receipt of guideline-directed interventions. Number three, a decrease in 30-day all-cause readmissions concomitant with an increased 30-day all-cause mortality. In summary, in heart failure patients, the first 8 months of COVID-19 pandemic was associated with a decrease in 30-day all-cause readmissions concomitant with an increased 30-day all-cause mortality with similar use of guideline-directed medical, surgical, or device therapy.
Based on our findings, we strongly urge heart failure patients not to refrain from scheduled clinic appointments and do not hold back emergency department visits or hospitalizations if needed, especially during times of increased COVID-19 activity to avoid unintended consequence of increased short-term mortality. We plan future research to ascertain potential resolution of adverse trajectories shaped by the early stages of pandemic and its accompanied measures. Our special thanks to the audience for their interest in our research at the Department of Hospital Internal Medicine, Mayo Clinic Health System, Austin, Minnesota.
Thanks for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.